Okay, so today, juniors, I know it's exciting times, but we still have a job to do. So it's just another opportunity. It's not a punishment because you're not here. It's just the best opportunity that we have to present information to you because you are not here. Okay, we talked about this a little bit yesterday, okay? So if blood is returned, this is on page 560, if blood is returning from the rest of the body, okay, and that's part of the systemic loop, so on page 560, you can either look at that top picture or that bottom one. That's where this diagram comes from. So where would blood return and what structure would that be? What vessel is it that returns blood back to the heart? And it has two different names to it. Because remember, if it's coming back to the heart, is that going to be the right atria or the left atria? Got a 50-50 chance. Why are you right? Because when we look at the structure of the heart, okay, because you said it's coming on the left side, and that's exactly what it's doing on the right side. When it comes back to the right side, that's exactly correct, because when we look at the left side, that's what I meant to say. We said this trick question right here, these two vessels and essentially these vessels here are the exact same. It's just that these are on the left side of the heart and these are on the right side of the heart. But they have the same name. And what would make that so tricky even though they are red structures? Those are actually veins because it's actually bringing blood back to the heart. Okay? So then, even though these are the pulmonary veins, they're red in structure, and it's still part of the systemic or pulmonary circuit. Now, that's a tricky question. Keep in mind, okay, even though it's coming back and it's red, that's another clue. All red, this again, dang it. I always got to remember that this goes to sleep quickly. Okay, so when we look at that, okay, I'll keep this up here. Another categorical difference is all veins do bring blood back to the heart. That is exactly true. Because when we look at this, this is a pulmonary vein, but this is a pulmonary what though? It's a pulmonary artery. So if it's bringing blood back to the heart, it's going to be a vein, and it's part of that pulmonary loop because it has lots of what in that blood? It has lots of oxygen in it, okay? This is going away from the heart, so it has to be an artery, but yet it's blue in color because it's lower in what concentration? It's lower in oxygen content, okay? So this is how we decipher this. Part of the pulmonary circuit, blood enters the left atria. It goes through this valve down here. What is it that separates this chamber, the left atria from the left ventricle? Why is that correct? Right, because it has two flaps, and what it's illustrating, I think it's just being covered up here, part of the tricuspid. Also, there's an R in tricuspid, that's why it's on the right side. But I think one of the things that students might ask from time to time is, why is it that this side would have 2 folds and a bicuspid, and this side having 3 folds as a tricuspid. And I think the best answer for that, at least what makes sense to me, is the idea has to deal with the pressure. Okay? So what we mean by that is when you look at page 561, that's a superior look, looking down on the heart. When there's a great amount of pressure in here, which there is, it's easier to have a good seal on 2 folds as opposed to 3. Okay? You might think, well, okay, why would you say that? Well, keep in mind, and we're standing on a mud puddle that's only, for instance, this deep, okay? So it's not like we're going to fall through and something to that effect. But that thin ice, is it going to be more sturdy if there's just one crack with 2 sides, or if in that circle there's a crack here, a crack here, a crack here coming to the center? Are you going to fall through if there's just 2 sides to that, or fall through if there's 3? Right, because again, you're exerting pressure on that area, okay? So then the pressure on this side of the heart is way bigger than this side. Reason for that? Because of the workload that this side of the heart has. Because as blood comes from the pulmonary vein into the left atria, drains into the left ventricle, then it's shooting out through here, okay? And this structure is what? It's a valve. Okay? Can you be a little more specific? Because there's also a semilunar valve in here. You just don't see it. You can see it on page 560 on that top diagram, but the one we have here is the bottom one on page 560. Yes, this is the aortic semilunar valve, and then should it be present, this would be what semilunar valve? Pulmonary semilunar valve. All right, so, and you can just say pulmonary valve too, that would be fine. Even just aortic, but we won't beat you up over that, but because technically that's true too. So 1, 2, it's going out through the rest of the body. Once it leaves the left ventricle, what part of the circuit is it? Is it pulmonary or systemic? Right, because it's going to the rest of the body. Okay? Then all this is going through the aorta and it's going up to the brain. Oxygen has been delivered, carbon dioxide's coming back or in the blood. So now it's coming through this part of the systemic circuit and enters into this chamber of the heart, which is what? It's on the right side, right atria, and it goes through which valve from the right atria to the left, or the right ventricle? This is the tricuspid valve, and then it's exiting through this structure, which is what artery? Pulmonary artery. And this is where we got to be specific. These two have the same name, okay? These are both pulmonary arteries. But what's the difference between these two? Here we can say pulmonary artery. Here and here we need to be a little more specific. Yeah, because this is the left pulmonary artery, this is the right pulmonary artery. Because one of the things that you can't see, okay, is this actually breaks, well, it doesn't break apart, but you could say diverges apart from one another, just like what we see here. This also diverges apart. Well, I guess it comes together, but if it was going this way, it's diverging. So that's what this does, is this wraps underneath the aorta and is going in that direction to the right lung. That's going to the left lung. Okay, so we're not going to spend a whole lot more time. We just wanted to discuss the heart, because the more exposure that you have to it, the better off that you're going to be. I think I said 5, was it 70? No. Okay. So there's a lot of structures that you are responsible for. So, and this does a decent job. But this might look a little confusing, okay? So that's why you have that book in front of you, okay? So, what vessel is this? And we got to be specific with these. It is an aorta. That's the aortic arch. Okay? Yeah, this is the ascending aorta, the aortic arch. Then over here, what do we see? That's the descending aorta. Then, and this is pointing to a specific muscle that separates the abdominal cavity from the thoracic. What muscle would that be? You don't have to know that, but just helps you categorize these two. It's the diaphragm. So now, what artery are we talking about right here? What part of the aorta? This is the abdominal aorta. Then as we keep going further and further down, this is where it starts to split to your left leg and your right leg. So it's an iliac artery, but it's got a common name for it. What would that common name be? It's kind of a, what do I want to say, mean on my part. And maybe it doesn't say on there. That's right. That's got that common name, okay? This is the common iliac artery, okay? Because once this splits, okay, now we need to be specific again. This is which iliac artery? This is the right, and then this one is the, okay? Then as it goes further down, okay, this has a specific name too, because this is branching off of this right iliac artery. It's just that this is the external, and maybe it doesn't say that in there.
It says internal.
Yep, so that would be the internal iliac artery, that structure right here. Now, we're being really, really specific here because this is perhaps what's going to be expected of you, ladies and gentlemen, in 1 and, well, probably 2 and 3 years from now, something to that effect. I don't know if you would take anatomy and physiology as a freshman in college, so that we really don't know. Okay, so we went past the common iliac to the right iliac, the right internal iliac. Then as we go further and further down, and it's not that it's a clear-cut path saying, okay, what we like to look at this is we know that since this broke off of the common iliac, or excuse me, the iliac artery, the next branch to where it branches off again, which is right here, okay? We can go a little further than that. It would make more sense if we went from here to here. What artery are we talking about here? What would that be according to what you see on 602? That would be the femoral artery, okay? Then what is it that we would see branching off of this femoral artery? That is the deep femoral artery, okay? And then once we get further and further down, what would you guess this is? I'm looking because of this bone here, because this is, I think that's pointing to just saying that's the tibia, so then this would be which artery then? Just like we know what this artery is. If this is the femoral artery, this must be which one? Tibial artery. And does that actually say that? It's okay, it says anterior tibial, but we won't go that far in depth. We would just say tibial artery, and we're okay with that. Okay, we're at about 14 minutes. I just want to spend just a little bit of time here, and then we'll save time, because the arms, I think, are, because that's what your classmate had said, that is what is so tough about the arm, because all the different ways that it breaks off, okay? Because once you have an exit, it changes names, it changes names, it changes names again. Okay. For some reason, we just want to talk about how blood gets to the brain. We'll save the arms for later, okay? But we want to know, how is our cranium and brain tissue supplied? I don't have an answer for you, but what we see here, this is what we call your subclavian artery right here, I believe. It might not even be on there. Okay? So then the reason that it gets to be kind of tricky is because this has a specific name here. And the left side does not have this structure. Again, I can't tell you why. It's just the way we're designed, I guess you could say. This short little section is what we call the brachiocephalic trunk. Okay? Then, once this brachiocephalic trunk exits or splits here, we have what's called carotid arteries. We have what's called an external carotid and an internal carotid. Then once you get past there, then you have a subclavian artery here. But it's not, look how far it goes until that happens. Here, once it branches off, this is already the left subclavian artery. But we don't have a right subclavian artery till we get up to here. Okay? So then, if these are carotid arteries, external and internal, okay, those are on the right side, what must this one be? Do you think? In other words, if you have a right carotid artery, chances are you're going to have a left one, okay? So again, the three structures you have is a subclavian, a left carotid artery, and a brachiocephalic trunk here that finally splits into your carotid arteries. Okay, I wanted to keep it around 15 minutes. We're about 17 and a half. And maybe you can't even see that on here, but we did our best to illustrate that. So we'll wrap this up for today, and we'll catch up to you next time.